Hello, my name is Tiffany Kale, and I am a PGY1 community-based pharmacy resident at Cape Fear Valley Health System.
Hi, my name is Paige, and I'm also a PGY1 community-based pharmacy resident at Cape Fear Valley Health System. Today we're going to be talking about how to use a medication for diabetes. The class of medications we'll be reviewing is called GLP-1 agonists, which stands for glucagon-like peptide 1 agonists. These medications work by helping your body secrete extra insulin to lower your blood sugar. There are a lot of benefits of using these medications. They're really great for heart protection over a long period of time, as we know that diabetes can affect our heart function. They're also really great for weight loss. They make you feel full longer, which helps you from overeating. All of these medications are administered subcutaneously, which means they're injected into the fattiest part of the skin. So there are 3 locations where we usually inject these medicines. They would be the outer thigh, the abdomen, or the outside of the arm. Most people prefer to inject these into the abdomen because it hurts less and it's an easier accessible area. There are some side effects of these medications. Because they're injections, you can notice an injection site reaction where there is some redness and swelling at the site. These medications can also cause nausea and vomiting. More frequently nausea than vomiting, but both are possible side effects. We're going to be reviewing 4 of these medications today. Bydureon B-Size, which is injected once a week. Trulicity, which is also injected once a week. Ozempic, also injected once per week. And then the last one is Victoza, which is 1 injection every day.
Another important topic that we would like to discuss today is in regards to the storage of these different pens and injectable medications. So overall, as a class, each of these medications should be stored in the refrigerator prior to the first use. After the first use, it varies based on the device. So now, before we get into each of the devices today, we just wanted to talk about the proper administration rules and techniques for all of the medications overall. And so prior to injecting any of these medications, one of the most important things that you will need to do is, of course, wash your hands. Before administering any of these medications, we want to make sure that our hands are clean as well as the injection site. So speaking of the injection sites that Paige had mentioned, so the back of the upper outer arm, the thighs, and the abdomen, we want to make sure that we're cleaning these areas with an alcohol swab prior to injecting the medication. You can let the alcohol dry for a few seconds prior to administering your medication so that it doesn't cause any extra burning or stinging. Then you want to make sure that you're inspecting your product that you're going to administer. So each of the pens, you will be able to see the solution, and so you want to inspect the solution to make sure that that the solution is not cloudy, that there's no particles in it, or any discoloration. And additionally, you want to make sure that the products are not expired. So each of the pens or any of the devices will have a manufacturer expiration date on them that you want to make sure you're inspecting to make sure that it is still within date. Another important thing that you would do before administering any of these medications is pulling the product out of the refrigerator about 30-ish minutes prior to administering it. And this is really to help the medication come closer to room temperature, and this will help you to not have any stinging or burning when you're injecting the medication. Another important thing that we would like to talk about regarding these medications is the proper disposal. So each of these medications, as we talked about, they are injections, and so therefore there is some type of needle involved with each of the devices. So it's going to be really important that after you administer your medication that we're disposing of either the entire pen, we'll talk about which devices are a one-time use, and which devices you'll be using multiple times to dispose of the needle on them. And so we want to make sure that everyone has at least a sharps container at home, which you typically can get from any local pharmacy. But if you're unable to get an actual sharps container, you can use either an empty laundry detergent bottle from home or even like a old coffee container that has like hard metal.
The first medication we're going to be going over today is Bydureon B-Size. The generic of this medication is exenatide. So you'll get your Bydureon in a box like this, and all of your GLP-1 agonists should come with instructions on how to use the medication as well. So on one side, they will have a demo sheet, and on the back side, they'll have specific warnings and instructions about how to use your device. For the purposes of today, like I said, we will be injecting into a modeling device. So the first thing you'll do with your Bydureon pen is make sure that it's in the locked position. Before you ever use the pen, it's important to shake it up really well so we can tell that the medicine is properly dissolved. So per the manufacturer, it's best to shake it very hard for 15 seconds. Now when you look at your pen, you should be able to see in the liquid here that there are no particles and it's a clear solution. That means that the medicine is ready to be injected. Next, what you'll do is unlock the device. This tells us that the device is ready to be used. Next, what you'll do is you'll take the cap off of the pen. Now this is an auto injector, so you'll never see the needle, which is a really great benefit of this device if you're afraid of needles. You always want to keep your pen upright until it's ready to be injected so that the liquid doesn't accidentally fall out for any reason. After you have cleaned the injection site, you'll put the pen against it and press straight down. You'll hear a click and you can watch the medicine be injected. After you hear that click, it's best to wait 10 to 15 seconds to ensure all the medicine has had a chance to get into the site. Afterwards, your pen is done, and as Tiffany had said before, because there's a needle in here, even though you can't see the needle, you have to dispose of this in a sharps container such as the one up here.
So next we'll be talking about the auto-injector pen Trulicity, which the generic name of this medication is dulaglutide. So for this medication, like I mentioned, it is an auto-injector pen as well, and so you'll get a one-time use pen, and it will come in the package, which also has the instructions on it if you ever forget how to use this medication. So the first thing you want to do once you pick your injection site and clean your injection site is to ensure that your pen is locked. Once the pen is in the locked position, you can then remove the cap. You just pull the gray part straight out. Once you have done that, you can then place the pen on the injection site. Once you have properly placed the pen on the injection site, you can then move the pen to the unlocked position. Once in the unlocked position, you are now ready to inject the medication. So you will press down on the green button on the top, which will release the needle, and you want to hold this down until you hear a second click. Once you hear the second click, your medication has been fully injected, so you may remove the pen. And again, there is a needle inside of this pen, although you are not able to see it, so we do want to make sure that we do dispose of it in a sharps container. The next device that we will be talking about today is called Ozempic. The generic name of this medication is semaglutide. So as you can see, this is your pen that you will get with this device, and it's very similar to the Victoza pen. So with this medication, you will remove the cap, and then you will be able to see the solution here, so you want to ensure that you're inspecting the solution. And as you can see with this pen as well, there is no needle attached. So the cool thing about Ozempic is that in the package, it actually comes with needles for you to use for each of your different injections. So for this one, we'll go ahead and take one of those pen needles, we'll open it up, and we will place it on and screw it onto the pen until we cannot screw it any further. We want to remove the outer cap and set that aside to keep. Then we can remove the inner cap, and that can go in the trash or the sharps container. Now we see that our needle is exposed. And so for the Ozempic pen, we do need to also make sure that this medication is working properly. So we want to dial the pen to the first solid line with the two dotted lines. And so in order to do the test dose, we then place the needle straight up and we hold down on the white button at the end to ensure that the medication comes out. And once it dials back to 0, that's when you know you're finished. So the medication came out, so we know that our pen is working appropriately. And again, we just need to do this for the first use. Now your pen is ready to be used. So we can dial to the dose that your doctor prescribed for you. And now you are ready to inject. So once you pick your injection site and have cleaned it, you then can place the needle directly in and hold down on the white button at the top until it clicks and gets back to 0. And this is how you know your medication is complete. You then want to still hold the pen in your skin for another 10 seconds to ensure that the medication is being properly absorbed. You then can remove the pen, and we want to use that outer cap to put it back on the needle and screw it off. And then we'll dispose of that in the sharps container. And then you recap your pen, and you are complete with your injection. Okay, so the next medication we're going to talk about today and show how to inject is called Victoza, and the generic name for this medication is liraglutide. So this is how Victoza comes in a pen like this. And so with this pen, you'll have to remove the cap, and then you want to, of course, inspect the solution and make sure that it looks fine. For the first time for the use of this medication, it is really important to test to make sure that the medication will come out of the pen appropriately. And so with this pen, as you can see, there's no needle currently on it. So with the Victoza pen, we do need to have pen needles that come with it. So you will remove the paper of the pen needle, and then you will place it over top of the pen here and screw it on until it feels tight and does not screw on any further. You will then remove the outer cap, which you want to save for later. Then you can remove the inner needle cap, and that one can go into the trash or the sharps container. So now your needle is exposed. And so since this is the first time that we'll be using the medication, we want to do a test dose to make sure that the medication will come out properly. So in order to do a test dose, you want to dial the dialer to the first line with the 2 dotted lines. That is to ensure that the medication will be coming out appropriately. So when you do the test dose, you want to hold the needle straight up, and you can press down on the dose button. And this will dial it back down to 0, and as you can see, some medication came out on the top. So that now means that your Victoza pen is ready to use and the medication will be administered properly. So now you are ready to administer the medication. So once you have selected and cleaned your injection site, you then can dial the pen to the dose that your doctor has prescribed to you. Then you want to grab your injection site and place the needle straight into the skin, and you'll press down on the white button on the top to dial the medication into the skin. And this will then take the dial back to 0. And that is how you know that the medication has been fully injected. One really important thing with this pen is you want to continue to keep the needle in place in your skin for about 10 seconds to ensure that all the medication has been injected. Once you are done that, you may pull the needle straight out, and you can use that outer cap to place back over top of the needle to screw it off, and then place back into the sharps container, and then you can recap your pen.
Today we also wanted to touch on how to use a vital medication for anybody with diabetes, and that medication is glucagon. Glucagon is a medication that is used to reverse significantly low blood sugar. I know that y'all have been taught how to properly bring your blood sugar up if it does go too low, but this medication is more reserved for emergency situations. It's really only recommended to use glucagon if you can't eat, if you have passed out, or if you might be having a seizure. It's really hard for you to administer this medication if any of those things have happened to you, so it's best that you and your family and friends know how to properly use the medication. Today we're going to be going over 2 forms of glucagon, an injection, which is more common, and then also a new nasal spray. After you use these medications, it's important that immediately 911 is called to assess the situation and make sure your blood sugar has come back to normal. As soon as you are able to, it's also important to eat after you use glucagon and are able to swallow safely.
The first version of glucagon that we will be demonstrating today is the injection. This is a glucagon injection kit, and I would expect that a lot of people have these at home but maybe aren't quite comfortable using them or showing their family how to use them because it can be intimidating. If you ever have to use glucagon, when you open it, you'll notice there are two components. There's a syringe that should already have liquid in it and a vial with powder in it. The first thing we're going to do is mix the two products. Now, I do want to preface by saying that in the event that you have to use glucagon, it is an emergency. So there's no need to perform alcohol swabs to clean anything. The most important thing is making sure that the person is safe. So we'll open the vial, take the cap off of the pen or the syringe, and here we see that there's a needle exposed. We put the needle into the vial and squirt all of the liquid in. Keep this syringe. Next, close the vial that has the liquid and the powder in it and mix it. It should just take a couple of slight swirls to make sure that all of the powder is dissolved in the solution. This has your active medicine in it. Next, what you'll do is put the needle back into the vial, draw up all of the liquid inside. You should be able to just pull this part of the needle all the way back, and then all of the liquid will be in this clear spot. Afterwards, you can take the syringe out, and it's best to inject this into the thigh. And then you press all the medicine down and take the needle out. Afterwards, you will throw your syringe into a sharps container because it also has a needle attached to it. The last medication we will be reviewing today is a nasal spray that contains glucagon. It's called Baqsimi. Just like the glucagon injection, it's important for you to instruct your family members and your friends on how to use this medication, because if you're having severe low blood sugar, you probably won't be able to give the medication to yourself. So just like a lot of our products before, when you open the box, this comes with a list of steps on how to properly use the nasal spray. The nasal spray comes in a tube like this. It's important not to open the tube until the person is ready to administer the medicine. Inside the tube is your device. This is your nasal spray device that contains glucagon. You hold it by placing your two fingers in between the administration site that will go into the nose and your thumb on the plunger which will administer the medicine. You will put the part that goes into the nose all the way up until the nostrils are resting on the fingers. And then you press the plunger until the green line has disappeared. That's how you know all the medication has gotten inside the nose.
So we really hope that everyone learned something today. I know we went over a lot of different medications and how to use all of the different devices. It can really be overwhelming sometimes, especially when you get a new device that you're unfamiliar with. We just really recommend that anytime, either now or in the future, if you ever have questions about any of your medications or how to use them, especially the devices, we would love for you to go see your local pharmacist. They're very well trained in how to use all of these different devices, and they should be able to answer any of the questions that you have.